All right, so the last video we stopped at this slide talking about birth. So I'll repeat the same thing again and I'll move on to the next level. So birth usually occur in 3 stages. One of it is dilation, the second is expulsion, and the third is the placental stage. Why is it broken? Why is it broken down into 3 stages? Because if there is no dilation, there is no birth. So the dilation means the expansion of the cervix. So the cervix is usually very tight together because it's got a very strong muscle holding it together. So it needs to open, and the nurses will say 3 centimeters is not enough to bring contraction. So it needs to be around 7 to 10. Many nurses will tell you it's 10 that the baby would come out. But some people within 8, 7, or 9, they can have the birth. So, and the beginning of the child birth, which is called the birthing process, is called labor. So when you say a woman is in labor room, or she's laboring, the meaning is she's having contraction. So, and contraction of the uterus make the environment uncomfortable for the fetus. So the baby wants to come out. So, and a sign the baby is going to be born is a dilation or opening of the cervix. If the cervix is not open for some hours and there's been a consistent contraction, so what the doctors would usually do is they give injection to stop the contraction. So once the contraction stops, they take the woman to the CS room for cesarean operation. Because if the contraction continues too long and the cervix is not opening, it might cause harm to the baby. So this is amongst the things they usually do. So there is something we call the amniotic sac. This is a sac in which it contains the amniotic fluid. So the amniotic fluid, the sac will cut open, is going to tear, it rips off. So when it rips off, the amniotic fluid will flow out through the vagina. And when that happens, it's sometimes called water breaking. So once the water breaking thing happens, so that means the baby is on the way coming out of the cervix, and is coming towards the vagina. So the next level, this is an example of what I was talking about. So this is a good position actually. So like I mentioned to you before, the doctors usually do several tests like ultrasound to know the position of the baby before the 9th month. So if the baby is breech, if it's not starting normal way, if it's not head down, so the doctors would tell the woman before the contraction time to come for a cesarean operation. So this is the reason, because it's not easy for a baby that is already huge to turn. Although some very patient doctors, they do some massaging and it's change the direction of the baby. And it usually happens, it works. So, but some doctors are very impatient. They just tell you, cause go to the operation room and they take the baby. Even the husband usually do it. They just take oil, massage it, know where the head is, and soft massage. Do that for like 30 minutes. Not clumping it. If you clump it, then that means you're not a patient husband. So this, as you can see here, this is the uterus. This is the umbilical cord. So the umbilical cord connects to the placenta, which is connecting with the wall of the uterus. So this is the cervix, which we mentioned earlier. So you need to open to around 10 centimeters before the baby can be born. So the size of the vagina does not have anything to do with the birth of the child. It's elastic, but the cervix is the main thing. So once the cervix doesn't open, then it's a big problem. So they have to wait for that. So this is called dilation. Now the cervix is dilated, is open, and the baby is on the way coming out. So the mother would consciously would contract our abdominal muscles to help push the baby. Sometimes they say consciously, but in most cases, they have to tell the mother to push. So once they tell the mother to push, the pushing method is a contraction of the stomach walls, of the walls of the stomach. So the contract, like you want pushing like you want to poop. So you contract the walls of the stomach too. So they do that and the process to push the baby. Usually the head comes out first, and yeah.
Does it hurt the baby?
No, it doesn't hurt the baby. The baby doesn't get hurt because the baby is still within the uterus. So the uterus is very huge muscles protecting the baby. And also the baby's got enough fat to protect. And secondly, the baby doesn't have bones. Most of the things they have is cartilage. So most of the time they don't get hurt. So when the mother contracts the stomach so much, so the baby would find a place uncomfortable and the baby usually come out. So most of the time it used to be aired down. In some instances, it might be aired up, so the nurses will quickly flip it so that it does not get some blood or liquid into the nose or the face. So if that happens, they suck them out from the nose and the mouth. You see, they suck all these things out to clean it so that the baby can. So this is called expulsion stage. So this is the stage 2. So the stage 1 was the contract or dilation, and the stage 2 is the expulsion stage. And the stage 3 is what? What is it called? What is the stage 3 called? Placental delivery. Thank you very much. So, or the placenta stage. So the placenta detaches. It's not that it does happen immediately. A child could be born like maybe after like 10, 20 minutes, then the placenta will detach. You don't force it to come out because I told you yesterday, it's been entangled. The placenta is entangled with the wall of the uterus. So it's just like it's been connected like a hook, like it locks into the walls of the uterus. So that is the reason why the placenta detaches from the uterus and leaves the mother's body, along with the extra embryonic membranes in the placenta stage. So what usually happens is the nurses will tell the person to wait for the placental delivery. They deliver the placenta like the way the baby has been delivered as well. So you can see now the placenta, this is umbilical cord, then the nurses or the midwives, they pull them out and they deliver the placenta. So in most time, the time between the baby and the placenta is around 5 to 20 minutes, even maybe sometimes 30 minutes. So, but it usually takes different time to come out. So now let's talk about infancy. After the baby has been born, the infancy is the first 2 years of the human life. So the first 2 years of the child's life is called the infancy. So the first year is the most rapid period of growth. A baby born now with kilograms of like 4 kg, go see the baby after 2-3 weeks, the baby is put on weight up to like 7 kilograms. And due to the attitude of eating a lot, they're taking a lot of breast milk. So it's a rapid period. And the first year, the baby are growing very, very rapidly. So infancy, if someone asks you what is infancy, it talks about the first 2 years of the human life. What about the childhood and adolescence? The childhood is a period of growth and development that extends from the infancy to adolescence. The people usually say the childhood is the most important time of the baby. This is the time the child has to eat a lot of food. It needs to get a lot of nutrient because this is a time the child is developing. If the nutrient is not enough for the baby, then the baby will be malnourished or malnourished. So malnourishment is something that would make the child look so miserable when the child is growing. It could lead to kwashiorkor, could lead to different diseases if the child is malnourished. So Puberty marks the beginning of adolescence. The signs of puberty, we know them for male and we know them for female. So puberty begins between the age of 8 to 13 in girls. And in boys is from age of 10 to 15. So that's the reason why the girls usually get bigger in size compared to the male at a point in time. So if you have twins, if you have a twin sister, you're growing at the same age, suddenly she will just get bigger than you. So because this is a normal thing for the female, they have a rapid growth when they're about to get to the adolescence age. But the boys is between 10 to 15 years. So I had a boy yesterday telling me he's been having wet dreams recently that he slept after 5 years and he's got wet dream. I say, yeah, that's a sign of adolescence. So he said he's not been having it before, but in the last 3 months or 4 months, it's been rapid. That's possible. Whenever it happens, you do the normal thing, you take the normal bath. So the adulthood, this is the time after the war, after the adolescence. So at the end of the adolescence, the physical growth is complete.
Okay, so when does a man stop growing in height?
Stop growing height.
Yeah.
Yeah, when it gets to the adulthood age.
Right.
Around 1920. So if you're growing to 18, if you're not careful, you would remain the growth you are at 18. A little bit, you might have just a little bit improvement, maybe height or whatever, or maybe if you pull on weight, but it's not that you're growing.
There's still time for me. I wanna be 6 foot.
You want to be 6 inches?
Yes, no, 6 foot.
6 foot.
Yeah.
Inshallah. I wish you the best. But stand up now, let me see you.
5'8". You did ask me.
I'm not taller than you.
Yeah, I think we're the same height. No, I think you're a bit tall.
I'm not taller than you.
My hair is very long.
Huh?
Yeah, same height, same height.
Is it not, is my height?
Yeah.
Let me check my Swedish idea. I can remember, but notice this 177.
177.
So it's a good.
I thought I was like 174.
No, you're 177. It's a good. Maybe you've improved a little bit.
Yeah, maybe.
Because when I started teaching you, you were not up to this height. So you were a bit taller than Adam, but I noticed you got any.
Now Adam's like very short.
Yeah, you look shorter. Yeah. So it's good. So at the end of the adolescence, the physical growth is complete. So that is the end of, you cannot have a rapid growth anymore. So marking the beginning of adulthood. So the physical changes perhaps are the most noticeable signs of aging. So the physical changes in your behavior or in some things in your body. So you shows you that you are aging already. So maybe you start growing gray hair or whatever. So all the changes include a decrease in the muscle. So the muscle would start to decrease, the mass would decrease. So you slow down, overall metabolic activities will slow down a little bit. Before when you were younger, you can eat 12 midnight and you don't have constipation. But if you try that, when you get to adult, when you become an adult, you would most of the time have constipation. So many things you do, you walk, you have a little bit of sleep and you spray your ankle, you lifting up something, you start having pain on your wrist. So all of these are signs of the fact that you become an adult. So, and a decreased pumping ability of the heart. So the heartbeat, the pumping rate stops, it drops a little bit. So when you're still in your adolescence or when you're still in the early stage of being an adult, you have a lot of activities which you do. So this is the end of the growth stage. Many more things would come up what we'll talk about in the next slide. So, but before that, let's start with these questions first. Abdulaziz, this is yours now. At which measurement is the cervix fully dilated? I think I mentioned it. Huh? Did he say C? Did you agree with him?
Yeah.
1 minute, please. I think So it's 10 centimeters, like Abdulaziz mentioned. So it starts very slowly, and once it's close to the time to give birth, it speeds up. But 10 is when it's fully dilated, it's 10. So any child, no matter how big the child is, would get expelled at 10 centimeters. Now the next one goes to Robbie. When a pregnant woman tells our doctor, my water broke, what does she mean? The amniotic sac is torn. That's good. When it tears, the meaning is that sometimes most of the doctors, when you tell them my water bag broke, they will tell you don't move. They tell you don't come because you might not make it to the clinic. It's either they tell you to find anyone close by to help you with the delivery, or they tell you the emergency truck is on the way. Because even if you want to go anywhere, you might end up dropping the baby on the way. Yeah. So it's a very delicate time. So what is the name of the structure labeled A in the illustration that is for Faris? The one labeled A. Huh? You mean the placenta? Yeah, that's correct. So during which stage of the birth does structure A leave the female's body? Marzouk.
E.
Huh?
E.
During which stage of the birth? You mean C or D?
D. C.
How many stages do we have? How many stages of birth do we have? 3. What is the first one? Dilation, expulsion, placenta stage.
I knew it was the last one.
So it is the placenta stage where the placenta has been delivered. So the answer is the 3rd. We don't have a 4th one. C. Huh? Yeah, the cuts. Yeah, that's something where they mentioned. That's a good question. So what the midwife does is she cuts the placenta in both sides. They use a clip. They clip the placenta in both the mother side and the fetal side. So then, after that, after the clip in both sides, and there's something also I need to mention to you. When a baby has been born, they usually bring the baby to a low level compared to the mother. They will not raise the baby up. When the baby is born, they bring the baby down a little bit. Can someone tell me the reason? They want more blood to flow from the mother's body into the baby's body. Some of these tricks, some young doctors don't know. You know, when you go with the wife to the hospital for delivery, sometimes you want to smack somebody. You know, they act somehow weird sometimes. Yeah. Yeah, I would explain it. Huh? Back in the day, this is what they don't cut in both sides. They clip in both sides. No, but before they just. No way. Who does that? No one does that. So they clip on both sides because after they've had enough blood and nutrient from the mother to the baby's body, they clip in both sides because either side they cut from, there will be a wastage of blood. So they clip on both sides. So that they've had enough in the baby's body, but there's still some remaining through the placenta. If you rip it, there will be a flow from the placenta and everywhere will be messy with blood, nutrient, and everything. But once you clip on both sides, you reduce the flow, and you cut the middle, a little bit blood is going to flow out, but it's going to be controlled. And also, the placenta, because the placenta is connected, the umbilical cord is connected to the baby's button. And you cannot remove it immediately. So if you cut from one side, it's going to be too huge on the baby's side. So what do? They would cut it close to the baby's side. So they can have the umbilical cord being left in the baby's button for some days. It dries off and it dries and falls off by itself. So many people usually are very careful with it because it could cause infection for the baby if it's not taken good care of. So, and the one from the mother is been brought out, been discarded. So some would prefer to bury it on the likes. So the point is, we just have to understand every reason for everything being done. So many times people do things just because they want to save more nutrient, energy, blood for the baby. So that's the main reason. So the next one goes to Al-Walid. During which year of a person's life does the most rapid growth occur? A, the first year of infancy. A, okay? That makes sense. Yes, yeah, sure. So this marks the head of the